So yeah, I practice in Allahabad, which is kind of a tier 2 city. So I have done my fellowship from Narayan Nethralaya in Bangalore, and which is one of the premier institutes. And once I went back to my private practice in Allahabad, so there was a big culture shock. You know, once you study in the south and once you come to the north, and again, once you study in an institution in a bigger city and you come back and practice in a comparatively smaller city, then obviously there is a culture shock. You are lost, confused, unsure, little disoriented. All those other things are also there in terms of patient communication. So once you practice in a smaller city, the paying capacity is obviously less. Since I practice retina, we all know that the amount of investment we do in retina is a lot more than what they are able to pay us. And again, they tend for the similar kind of thing, like if they have to do any premium surgeries or any retina surgery for that matter. So the amount of investment is a lot more, and patients tend to pay lesser in smaller city for the same thing. If they'll go to Delhi, Bangalore, for that say Chennai, Hyderabad, they'll pay in lakhs, and if they come to us, they'll tend to pay lesser. Then they have this mall versus general store there. They have this mentality of mall versus general store. Like once you go to a general store, you know, bargain, and if you go to a mall, you never bargain and you just take it for the MRP and you don't even ask for it. So that kind of mentality is there in smaller cities. Again, a lot of quack practice in smaller cities. The patients are less educated. There is less awareness among the patients, and they tend to present very late in their condition. So again, in terms of practice, if you see, there is difficulty in getting good paramedical staff, you know. A good optometrist is very difficult to get. Immediate availability of good medicines, all those, like, even if you have to order an important intravitreal injection for that, say you have to order from Lucknow or Delhi. And again, if there is instrument breakdown, then repair of the instrument is difficult in a smaller city. Again, emergency facilities and all the higher investigations. For example, PCR was so commonly done there, and you don't get to do it here, biopsies and all those things. So patient tends to think that bigger city has better treatment, although if you have done it from a good institute, premier institute, still patients think that if they go to, you know, Chennai, Shankar Nethralaya, LV Prasad, they'll get better treatment. So again, in terms of academics, if you see regular CMEs in bigger cities like in Bangalore, we used to have conferences, CMEs every month. In Allahabad, for that say, they don't even happen for 6 months for that say. Again, newer technologies, newer like OCT angiography, ICG angiography is not available in the city at all. Then bigger machines and electrophysiology, genetic testings and all those things are not available in smaller cities. Again, the city life is not there. So poor patients, again, they tend to go to charitable setup, camps and government setup, and higher paying patients, they tend to go to the higher city. So again, when there are cons, there are pros also. Like if you see doctor to patient ratio, for example, if you see Mumbai and in Bangalore, a lot of, you know, there are 50 to 60 to hundreds of VR surgeons practicing there. Although in smaller cities, you just have 4 to 5 super specialists. So the doctor to patient ratio is good. Again, there is lesser competition, there is lower cost of living. You don't need cutting edge technologies to start a practice. You don't need bigger building, good looking building to start that practice. Again, you can start in a smaller setup. You get the staffs at cheaper rate, and it is comparatively, it is not as saturated as a bigger city. So those were my takes in practicing in a smaller city when I came back from an institute.
Thank you, Dr. Sameeksha. So I think you have just started. I also just started in a tier 3 city, that is Ara. Sir also is practicing in tier 2 city only in Patna, but at least he is in RIO, so he must be facing not facing the financial difficulty because it is a government funded institute, but still the acceptance part is very difficult.
I think, um, see, in Sameeksha slide there were a lot of cons and there was one slide on pros. so,
So we should focus more on pros.
yeah. I think you have to take a call. I mean, when you start, you have to take a call. No, it's the grass is always greener on the other side, right? In Bombay, if you ask somebody, and I'm a retina surgeon, I talk to my fellow retina colleagues, and most of my colleagues are attached to 4 or 5 centers. That is what I know. They don't have a single center. So in the amount of time that you take to grow big, where you have your own setup, where you can influence, where you can have an impact on the society, is the time. You know, there is always a denominator called time, and that time denominator is very important. That how much time it will require. So that is the process of having in a tier 2 or tier 3 city, where you can grow a big, and then as a independent, I am talking about right now about solo practice when I am speaking my thought process. And then when you can impact the society at every point of life, no, you always question yourself that how my things can impact the society. So the point to attain that, the time factor is very less when you go in a tier 2 or tier 3 city. But if you start in your tier 1 city, even in an organization like LV Prasad or Sankar Netralaya, you might take 20 years. I have my coaches who are not satisfied even in Sankar Netralaya at 25 years of practice because they are not able to impact the way they think, right? So, but then, as you have said, there are a lot of things which you get access to being in a tier 1 or tier 2 city.
Dr. Abhishek has rightly quoted that if you are working in a tier 1 city, that you have got lots of competition, lots of eye surgeons are there who will pose competition to you. But if you are working at a small place, you have open field is there. Though the patient think that for costlier surgery we have to choose higher centers, but you have to select your group audience, whom you have to focus there. Then you cannot immediately.
With current, I think the pace of life has changed a lot in the last 10 years. And in the current pace of life, if you are giving a good service at whatever place, the person who is taking that service, I mean the patient party, they are not ready to sacrifice time if they are getting a good service at that place. Right now, Nilesh has invested a big machine at his own setup. So he must have an audience for that who are ready to buy that service and pay for that service. So I think that thing has changed a lot in last 10 years. Nobody wants to waste time. Everybody has time is, even for a farmer, the time is very precious these days.
So for me, when I shifted, it is a tier 3 city. My father has his own practice, so everybody thought that it is because he is having a practice, so I just want to join that. But I hate traveling. I don't want to waste my time in car. So in Delhi, if you are traveling from point A to point B, at least 3 hours a day you are just wasting. Every day of your life, 3 hours you are wasting. That should not happen. In this, I just come down from my home to my clinic. It takes 2 minutes. So I am available 24/7 for my patients if there is any emergency. I have fixed hours, but still for emergency I am always available. It is very easy for me to do. And then out of my practice, I am taking out 1 lakh rupees and per month as a salary, and I don't know what to do with it. In a in a metro, if you are earning 3 lakhs and you don't know, it is not even sufficient to meet ends with 3 lakh of salary.
Yeah, but then it's just
No, just for economics, because everybody.
Apart from the economics, like if you are in a big city, there are things that your old generation has already built on. See, we as a researcher are just putting one more step to the numerous steps that have already created by our own older generation. So in a tier 2 or 3 city, you will be the person, you might be the person who is creating the first step. You know, you create an institution, but if you are in a tier 1 or tier 2 city, there might be already a lot of steps already created, and you have to just bring one more step to that. So in the whole perspective, you will be able to achieve something bigger in a tier 1 or tier 2 city. But in a tier 2 or tier 3 city, you might be the first person who will be creating an avenue for where your next generation can come and they can do something very big which can impact on a research or an academic purpose. So that is a balance you have to find in your mind your place that where you want to.
Yeah, and in tier 2, 3 cities, you can go beyond yourself and create impact. That is a very good point.
That social impact factor is.
Yeah, it's much more than a single person.
Yeah.
The problems are there, three problems are there. Keeping yourself busy in the practice, having good quality cases, and the economics. These are the three issues. So you have to organize yourself, you have to select the means you have to make your community with other private practitioners, and database of your patients in timely messages, WhatsApp messages about your setup and other things, and getting themselves screened in time. So this will improve your economy and will give you quality cases also. And with time, with 2 to 3 to 5 years of practice, you will become so much busy that all these things will not affect you.
And can
That-
I add one more point? I mean, even if you are practicing in future in a tier 2 or tier 3 city, never underestimate the power of social media. Show your skills on your social media, because everybody, even the farmer who is sitting and doing the crops, he is also watching the media. And if they see that the same skill is being provided by you in their own language, you have to communicate in their own language. You can't be very technical while you are communicating, right? You have to communicate that this technology, this asset is available in your area. So you have to be ready to show your skills in the social media also.
That's what I shared because we launched our website. It was unheard of to book an appointment through online, through a website in our city. I launched it just because patients were traveling a long distance, and we have a concept where we see a fixed number of patients, just like this. You have to take prior appointment to visit us. So the patient had to travel from village to our center and then come back another day. So we started, and to our surprise, we have around 125 bookings in last 4 months. That from starting from zero, it is very good, and all of them are from villages. They are from villages. Normal illiterate person getting somebody to book their appointment, and they are repeat customers that they are coming. So we don't know what will click, and the dynamics are changing. So the tier 2 and tier 3 city is more tech savvy right now, because they are on phone, because they have a lot of time, so they are on phone more.
And one more thing, that if you are confused in your career that, I want to settle, I don't want to settle, give it a try.
Yeah.
Give it a try. Go stay there for 6 months. If you don't like, come back.
Yeah.
But give it a try. Don't commit economically too much, that I'm investing that much. That is the catch. The catch is that you invest too much and then you get caught. Give it a try. If you don't like it, come back.
Thank you, Sameeksha. I hope you will find more pros again in